This podcast is about dermatoscopy of lesions with a pattern of clots, or if you prefer, a globular pattern. Clots in my language are well-circumscribed objects that are larger than dots and may have any shape. They may be small and oval, or may be large and polygonal. First, let us resolve some issues related to terminology. Globules, or what is usually called globules, are small oval clots, usually brown. Here is a lesion with a globular pattern. I call them small oval clots. Cobblestones are also clots, but now they are large and polygonal. This is what you know as cobblestones. These are also clots, but now they are not small and oval. They are large and polygonal. Blue ovoid nests are also clots because they are well-circumscribed objects, and they vary in size and shape. They can be oval or they can be large and ovoid if you want. Here in the basal cell carcinoma you have ovoid nests, but in my language it's just blue clots varying in size and shape. So we have the same term for the same object. Lacunes or lagoons or whatever you want to call them are just red clots. That's simple. Here you see lacunes or lagoons, in my language red clots. Now comedor-like openings may appear as yellow clots and mealy-like cysts may appear as white clots. This pertains specifically to seborrheic keratosis. Here you can see white clots and yellow clots. The yellow clots are comedor-like openings that are filled with keratin and melanin, and here the white clots are mealy-like cysts. So mealy-like cysts and comedor-like openings may appear as clots on dermatoscopy. What is the difference between a pattern of clots and a pattern of dots? Well, a pattern of dots consists of elements that all have the same size and the same shape. They are small and round. But a pattern of clots consists of elements that have different sizes and different shapes. Now we also need to know the color, because this is important for the differential diagnosis. We have different types of colors, including the color of melanin, black, brown, gray, blue, keratin, orange, yellow, white, and hemoglobin, red or purple. And hemoglobin can also be black when you have congealed blood. This is important. Now, what about the differential diagnosis of lesions with a pattern of clots? It depends on the color. If you have red clots or purple clots, it's usually a hemangioma or a vascular malformation or hemorrhage. Yellow and or white clots usually mean seborrheic keratosis. Skin-colored clots, usually a dermal nevus, congenital nevus type, unus nevus or Misch's nevus, or rarely a seborrheic keratosis. Brown clots, many types of nevi have brown clots. Black clots, usually it's a hemangioma, a thrombosed hemangioma or a hemorrhage. And blue clots usually means basal cell carcinoma. Now let's see some examples. A pattern of clots, and the clots are red, so the diagnosis is angioma, hemangioma, correct. Now which type of clots? There are white clots and yellow clots, some of them orange. This means seborrheic keratosis. Here you have yellow clots, seborrheic keratosis. Here you have skin-colored clots, dermal nevus, type Una. Here you have brown clots. This is just a congenital nevus. Here you have brown clots, again a congenital nevus. You can diagnose the congenital nevus with certainty because of the increase of terminal hairs. Brown clots, they are so big. The clots are so big that we may call them, if you like, cobblestones. It's also a congenital type nevus. Black clots. Usually it's a thrombosed angioma, like in this case. You also see some purple clots here. When you see black with red or purple, it usually means blood. Blue clots. This is basal cell carcinoma. That's easy. Now what about if there is more than one color? Now you have to differentiate between lesions that have melanin predominating or lesions with other pigment predominating. If you have white or yellow clots or yellow and orange clots, the main diagnosis is seborrheic keratosis. If you have red or purple clots, again you have hemangioma or rarely melanoma. If you have melanin predominating, now we are here in this part, you have to differentiate between lesions with symmetrically distributed colors. Then you usually have a nevus, including congenital nevus, Unna nevus, combined congenital nevus, and Spitz nevus. If the colors are not symmetrically distributed, then you have to look for clues to basal cell carcinoma or melanoma. If there are no clues to malignancy, you have to deal with the diagnosis of seborrheic keratosis or nevus again. Now let's go for some examples. Multiple colors, but the main color is not melanin, it is the clots are white or yellow or orange. Some of them are brown here, but most of them are white and yellow, so the diagnosis is seborrheic keratosis. Here we have multiple clots. They vary in size and shape, but also in color, and the color is black in the center and brown at the periphery, and also some gray clots. But the colors are distributed symmetrically, so it's a nevus, in this case a Spitz's nevus. Here we have clots and the color is red or purple or even black, but the color of hemoglobin is predominating and not melanin, so it's an hemangioma. Here this looks very similar, but this is a difficult lesion. You also have blue clots, purple clots, black clots, but also some white clots. And what's the diagnosis? This is nodular melanoma that you should not miss, that is simulating a hemangioma. Now why is it not a hemangioma? Because you can see here nicely in this clot there are some vessels. You never see vessels in clots of a hemangioma. For example, let's go back. Here you see the hemangioma. There are only clots and no vessels within the clots. So this is a melanoma that you must not confuse with a vascular lesion. If the colors are distributed asymmetrically, we have to look for clues to basal cell carcinoma or clues to melanoma. And sometimes we can differentiate between basal cell carcinoma and melanoma. Here we have multiple clots. The clots are blue and brown. And there's also a structuralist part. But we have also some clues to malignancy. Gray clots, yes, a polymorphous vascular pattern. Now, what is more likely, a basal cell carcinoma or a melanoma? Well, blue clots can be found in both. What else? A polymorphous vascular pattern can be found in both, but in a basal cell carcinoma, you expect serpentine branched vessels. So what is more likely in this situation here? A melanoma, correct, which it is. Now, this lesion here also has clots. The colors are gray and some are brown. And there's also a structuralist zone here. So again, we have to exclude melanoma, basal cell carcinoma. Now, gray clots can be found in both. They're more common in basal cell carcinoma. Now, what about the vessels? You have serpentine vessels, not branching, but serpentine, that's enough. And you also have some radial lines at the periphery. They can be found in both, in melanoma, basal cell carcinoma, but if they're thick, and if they have a common base, it's more likely to be a basal cell carcinoma. So what is more likely here? Basal cell carcinoma, of course.